Hello and welcome to Fix Your Smile, where your oral health means a lot to us. Did you know that mouthwash is not a modern invention? It is far from it. Ancient Romans used a rather strange ingredient to keep their mouths clean. They would rinse with aged human urine. The ammonia in the urine acted as a disinfecting agent, helping to whiten their teeth and kill germs. Thankfully, we have come a very long way since then. Today, our mouthwashes are scientifically formulated. They are designed to be safe, effective, and much more pleasant to use. But even with these modern marvels, many of us are not getting the full benefit from them, simply because we are not using them correctly. The purpose of mouthwash has evolved significantly over the centuries. It's no longer just about masking bad breath with a strong minty flavor. Modern therapeutic mouthwashes are powerful tools in our oral hygiene arsenal. They can fight plaque, prevent cavities, reduce gingivitis, neutralize the sulfur-producing bacteria that cause chronic bad breath. Think of mouthwash not as a quick fix for the garlic bread you had at lunch. Instead, see it as an essential part of your daily routine. So, why do so many people use mouthwash incorrectly? A big part of the blame lies with how it is often portrayed. Think about what you see in advertisements on television or online. An actor takes a quick swig from the bottle. They swish it around vigorously for a few seconds, maybe puff out their cheeks. Then, they spit it out and smile confidently into the camera. This whole process takes about 5 seconds. It looks cool and efficient. The problem is that this rinse and spit method is almost completely useless. It simply does not give the active ingredients enough time to work their magic. This common mistake is rooted in a misunderstanding of what mouthwash is meant to accomplish. Many people treat it like a mouth freshener, a breath mint, or a piece of gum. They use it for a quick burst of minty flavor to cover up an odor. While it can provide a temporary fresh feeling, that is not its primary function. A good therapeutic mouthwash is a medicine for your mouth. You would not take a pill and spit it out after 5 seconds, would you? Let's correct this common habit. Learn the proper technique. Follow these steps to get the maximum benefit from every single rinse. First, you need to use the right amount of liquid. Pour about 20 milliliters, which is roughly 4 teaspoons. Pour it into the cup provided or a small glass. Do not dilute it with water. Next comes the most important part, the swish. Take the measured amount into your mouth, but do not swallow it. Close your lips and begin to swish the liquid vigorously. Force it between your teeth and around every corner of your mouth. You should aim to continue this active swishing for at least 30 seconds. After you have thoroughly swished, it is time to gargle. This step is often overlooked, but it's critical for fighting bad breath. The bacteria that cause bad breath love to live on the back of your tongue. Tilt your head back slightly, and let the mouthwash pool at the back of your throat. Gargle for another 30 seconds, this helps clean that hard-to-reach area. Beyond the quick rinse, there are other common blunders that can sabotage your efforts. The first major mistake is using mouthwash right after you brush your teeth. This might sound counterintuitive. The fluoride in your toothpaste needs time to sit on your teeth. When you immediately follow brushing with a mouthwash rinse, you are essentially washing away all that beneficial fluoride. It is like washing your hands. A second blunder is choosing the wrong type of mouthwash for your needs. Many people grab the bottle with the most powerful sounding name. They often pick a mouthwash that contains a high concentration of alcohol. While alcohol does kill germs, it also has a significant drying effect on your mouth. A dry mouth is the perfect breeding ground for the sulfur-producing bacteria that cause bad breath. The third common mistake is relying on mouthwash as a substitute for proper brushing and flossing. This is a dangerous shortcut. Mouthwash is a supplement to your oral care routine. Now that you know the right way to rinse and what mistakes to avoid, let's go over a few extra tips. These will help you supercharge your routine. First, make mouthwash a consistent part of your daily schedule. The best time to use it is not right after brushing, but at a different time of day altogether. For example, consider using it after lunch. This helps to wash away food particles and neutralize odor-causing bacteria in the middle of the day. Another great tip is to pay special attention to your tongue. Your tongue is covered in tiny bumps and grooves, making it a perfect hiding place for bacteria and food debris. For an even better clean, use a tongue scraper before mouthwash. Do not be afraid to try different types of mouthwash to find what works best for you. To recap, the secret to effective mouthwash use is simple. Use the right amount, swish and gargle for a full minute wait before you eat or drink. Avoid rinsing right after brushing. Avoid harsh alcohol-based products. Don't skip brushing. Don't skip flossing. By incorporating these practices into your daily life, you are not just masking bad breath. You are actively improving your oral health. Thank you, and don't forget to like, share, and subscribe. Cheers.